Hello, this is Dr. David Green, CEO of the Georgia Pain Network. Today's topic is what you need to know about facet injections. Facet joints are small, thumbnail-sized joints on either side of the spine at every level from the neck all the way down to the sacrum. These joints have cartilage just like the hip or the knee, and together they combine to allow for an incredible range of motion of the spine. Another name for the facet joint is zygapophyseal joint. What makes them painful? Well, they're prone to arthritis just like any other cartilaginous joint. Even though they are small, they can lead to a tremendous source of pain. Typically leads to pain in the vicinity of the arthritic joint. Often patients have several arthritic joints at the same time, so it may cause pain in that area, or it can radiate to the sides, down. All right, here you have a picture kind of looking at an angle at the spine. Here you have the spinous processes, the bumps you feel on the back. This is a good looking joint here, okay? This one has a lot of extra bone formation around it. The red refers to inflammation, same type of thing here. And this inflammation can sort of spread into this adjacent area and irritate these nerve roots you see as they're trying to get out, okay? So why are facet injections performed? Well, for symptomatic facet arthritis, we don't have a great surgical answer. I mean, if you have multiple levels that are arthritic, it just doesn't make sense to do a spinal fusion because it's just going to keep getting worse above and below. We don't have a facet replacement yet. It's a very complicated joint. It's just not as simple as a knee or a hip. Not to say those are simple, but it's much more complicated. There are excellent non-operative options for pain emanating from these joints, and facet injections are one of them. Similar to other joints with arthritis, they respond well to steroid injections. It's an outpatient procedure. It's fairly quick, takes about 20 minutes. Modern pain doctors use fluoroscopy, which is a real-time form of x-ray. Typically, you don't need IV sedation. You can numb up the skin and the soft tissues down to the joint. A needle gets placed into the joint, and then oftentimes dye is injected to make sure the pain doctor has an accurate needle placement. Once satisfactory, then steroid and numbing medicine are placed. Several levels can be treated at the same time, and then the procedure can be repeated every few months. 82% of patients receive pain relief over 50%, and significant functional improvement was seen in just about 80%. And that's actually with or without steroid medication. Remarkable. The average duration of pain relief is close to 3-4 months. Same results were seen in two different studies, 2007, 2008. So facet injection is an excellent non-operative method of achieving neck or back pain relief due to spinal arthritis. If the pain comes back, there are 3 treatment options. One is to simply repeat the facet block. Another is to perform a medial branch block, which is where numbing medicine and steroid is injected around the joint in a couple different areas, but not in the joint. And that can work just as well. Or the patient can go on to have a radiofrequency ablation, which is where a catheter has thermal energy placed through it that deadens these nerve endings, and that can provide pain relief for 6 to 18 months. A facetal medial branch block, remember, is 3 to 4 months. These are very low-risk injections. There's a slight risk of infection, bleeding, or an allergic reaction. The needle does not go into the spinal canal or the epidural space, so there's a negligible risk of any nerve root injury or spinal cord injury. The top non-operative pain management in Georgia is through the Georgia Pain Network. There are multiple clinics throughout the state accepting over 50 insurances and providing over 25 treatment options with the board-certified doctors. Visit us online today at georgiapainnetwork.com and then call us for more information and scheduling at 404-850-9099. I'm Dr. David Green with the Georgia Pain Network. Your pain stops here.